Alright, team. The patient presents with colitis, permeositis, and osteitis.
What's our diagnosis?
Could it be Crohn's disease? It seems to match the symptoms.
I'm thinking more along the lines of lupus. Those symptoms can all be related to an autoimmune disease.
Maybe it's an infection causing all these issues.
We should consider that as well.
No. It's oculodental dysplasia. There's no doubt about it.
But that's such a rare condition. Are you sure, Hawks?
I've only read about it in textbooks, never seen it in real life.
This is a risky call, Hawks.
Are you sure we should go forward with this diagnosis?
Damn it all. I'm certain. The patient needs abdominoplasty immediately. It's a risky procedure, but it's the only way to save their life. We have to do it. You wanted to see me, Tracy?
Yes, Hawks. I heard that you want to perform abdominoplasty on a patient with oculodental dysplasia. That sounds like a stupid idea. Where on earth did you come up with that?
I actually learned about it during trivia night. It seemed like a viable course of action given the symptoms the patient is exhibiting.
Trivia night? Hawks, we can't base medical procedures on random trivia facts. We need to follow proper protocols and consult with specialists.
Here's a fun fact. Why does no one invite you to trivia night?
That's a fun question. Here's a fun answer. I actually care about the safety of our patients, and they're my top priority.
Wrong. The answer is actually that Tracy's a pain in the ass and gets off on watching patients die.
If I had enough money to pay for an air department, you'd be out of here and instantly trivialized.
Oh no, the patient is in critical condition. This is not what I was expecting.
How am I going to explain to Hawks that the abdominoplasty was not the correct treatment for oculodental dysplasia?
This is a serious mistake.
Shit! You almost killed our patient with your incompetence.
We did our best, Dr. Hawks. We thought it was the right course of action.
I still believe our initial diagnosis was correct. It was just an unfortunate outcome.
I disagree. I think we should have considered other options before jumping into abdominoplasty.
You three are a bunch of clueless idiots. How did I end up with such a team of morons? You couldn't diagnose a common cold if it slapped you in the face.
Trivia time. How many times have you told us that one?
Yes, we will take this as a learning experience and improve our diagnostic skills.
I agree, we need to be more thorough in our assessments before making any decisions.
I don't have time for this nonsense. Figure out the correct diagnosis and treatment, or you're all out of here. I'm done cleaning up your messes. Gary, you're uninvited to trivia night permanently for such an incompetent question. Now, get to work. I can't believe I still haven't figured out what's wrong with the patient.
Maybe you need to think outside the box, Hawks. Have you considered a rare genetic condition?
I did, but the genetic tests all came back negative.
What about an environmental factor, like exposure to toxins?
I thought about that too. But the symptoms don't match up with any known toxins.
Well, looks like you're stumped then.
Wait a minute. I think I just had a breakthrough. It's a rare autoimmune disease triggered by a recent viral infection.
Wow, that makes sense. Wait, where are you going?
I need to run some tests.
Thanks for the help, Johnson.
I've made a breakthrough, guys. Forget oculodental dysplasia. It's diphalia now.
What are you doing, Hawks? You can't just barge in here without proper equipment.
This is highly unprofessional, Hawks. We have protocols for a reason.
I can't believe this.
We have a patient on the table and you're making reckless decisions.
Trust me, this is the right call. We need to act fast to save this patient. I can't believe you doubted me, Tracy. If you had just listened to me from the beginning, we wouldn't have almost lost the patient.
Hawks, the wrong diagnosis could have been fatal. You should have considered all possibilities before jumping to conclusions.
Considered all possibilities. I did my research, Tracy. You should have trusted my expertise.
Expertise. It was reckless to overlook key symptoms just because you were fixated on one diagnosis. And you were basing this all off of trivia night. I would have loved to hear you try explaining that one to the patient's next of kin had this gone south.
There you go again. I told you that you get off to patients dying here. It's absolutely sick, and I can't believe I work with you.